Look at this microscopic view. What you are seeing is the root mechanic of diabetes: sugar molecules constantly bouncing off a cell membrane, unable to enter and be processed for energy. Because that sugar can't get into the cells, it gets trapped in your bloodstream. Over years, those high sugar levels act like sandpaper, silently degrading the blood vessels in your heart, eyes, and kidneys, usually without causing a single ounce of immediate pain. The only reliable defense against this is early detection. You have to locate the problem before the microscopic damage becomes a permanent reality. But walking into a clinic and asking to be tested for diabetes isn't a single uniform process. You have to know exactly what you are asking the lab to look for. Knowing you need a test is only the first step. The results only become actionable once you select the specific diagnostic tool that matches your current biological reality. You walk up to the clinic desk and you're immediately hit with an alphabet soup of options: FBS, RBS, A1C, and OGTT. If you choose randomly, you risk enduring a long, unnecessary fast. Worse, you might take a test that gives you a false sense of confidence while completely missing the early warning signs of disease. This decision tree shows the actual dilemma you face. Every path here represents a strict trade-off between the amount of preparation you are willing to endure and the exact kind of medical insight you need to extract. To solve this, we have to map out the exact preparation burden and the specific clinical purpose behind each of these 4 tests. Medical testing is not a consumer choice. It is a strategic match between the symptoms you are feeling today and the correct diagnostic pathway. We start with the snapshot tests. These diagnostics reveal your blood sugar level at the precise second the blood is drawn from your arm. This matrix breaks down the requirements. First is fasting blood sugar, or FBS. Notice the clock icon. This requires an 8 to 12-hour overnight fast. With an empty digestive system, it provides a clean baseline. A normal result sits below 100 milligrams per deciliter. The trade-off is steep. Fasting is highly inconvenient, and the result only tells you what your body was doing on that one specific morning. Next is random blood sugar, or RBS. The advantage is access: zero fasting, taken at any time. It delivers immediate data during sudden, severe symptoms. Because you may have just eaten, the normal threshold is higher, sitting under 140 milligrams per deciliter. But because the timing is random, it is a blunt instrument. An RBS test cannot reliably catch the subtle, quiet metabolic changes of early-stage prediabetes. Snapshot tests are highly effective for establishing a clean resting baseline or diagnosing a clinical emergency. They completely fail to show your long-term metabolic health. To understand your long-term health, we need tools that can look backward in time and observe how your body performs under extreme stress. We return to the matrix for the HbA1c test. There is absolutely no fasting or special prep needed. The HbA1c functions as a biological historian. It measures your average blood sugar over 2 to 3 months, with a normal average sitting below 5.7%. The trade-off here is precision. While it offers the best comprehensive monitoring available, it calculates an average, meaning it easily hides sudden, recent spikes in your blood sugar. Finally, the matrix gives us the oral glucose tolerance test, or OGTT. This is the ultimate metabolic stress test. The process is rigorous. You undergo an overnight fast and drink a heavy, sugary diagnostic liquid, and then sit in the waiting room for 2 full hours before the clinic retests your blood. It accurately maps exactly how your body metabolizes carbohydrates in real time. But because of the extreme time burden, it is almost exclusively reserved for pregnant women to diagnose gestational diabetes. Trend and stress tests offer the deepest possible metabolic insight, provided you trade either a broader timeline or an intensely uncomfortable preparation period. Even with the correct test, your blood sugar is never static. It is a constantly moving target influenced by the rhythm of your daily life. Take a look at this graph simulating a standard 24-hour period. Severe stress, a poor night of sleep, or a recent heavy carbohydrate meal will temporarily drive your blood sugar levels into chaotic spikes. These natural spikes can temporarily push your numbers into specific warning zones: prediabetes, landing between 100 and 125, or full diabetes at 126 and above. Because of these daily lifestyle variables, doctors rarely hand down a permanent diagnosis based on a single, marginally high reading. Analyzing a test result without factoring in your recent stress or sleep quality is like reading a single sentence entirely out of context. A follow-up test is almost always required to confirm the data. To remove the confusion of the clinic, you simply need to identify your specific patient profile. This scorecard graphic lays out the paths. On the left is the routine optimizer profile. This is someone with no immediate symptoms who just wants an annual checkup. If this is you, ask your doctor for an FBS to establish a clean current baseline and pair it with an HbA1c to verify your 3-month historical trend. Now look at the right side. This is the urgent warrior profile, someone currently experiencing sudden extreme thirst or deep fatigue. If you are experiencing active symptoms, do not wait 12 hours to fast. Go get an RBS test immediately. And if you fit the expectant mother profile, your doctor will actively schedule you for an OGTT to protect both you and your baby against gestational diabetes. Correctly matching your biological scenario to the right test ensures you get accurate, usable answers without wasted effort. Do not wait for physical symptoms to appear before taking action on your metabolic health. When you do go in for your test, make the physical process easier. Arrive well hydrated and wear short sleeves for easy access during the draw. The accuracy of these tests depends on the facility. Look for a lab with the modern equipment necessary to process your results with the speed and clinical precision required for a clear diagnosis. If you are in Bangalore, contact Arka Anugraha Hospital today to schedule the screening that matches your specific scenario. When you understand these 4 tests, you move past the confusion and take a proactive step toward protecting your long-term health.